Haribo has just taken a mixture of unknown drugs in this alcoholic drink. These drugs were used to spike the drink in quantities that are greater than the medically recommended dose or medically prescribed dose. Haribo is in danger of dying. Haribo intentionally misuses drugs like many of his peers for its one main desired effect. Yes, to get high. Haribo had not factored in that he had taken these drugs together with alcohol and he was just recuperating from a bout of severe flu. Haribo might have just signed a death sentence for himself. Why? Well, because different people respond to drug overdoses differently. How severe the effect or effects of the drug or drugs that Haribo took will also depend on Haribo's personal health status at the time he was taking this drug or drugs. Remember, he's not fully recovered from the flu, and not just any flu. COVID-19 virus, the Omicron variant. Some drugs can damage certain organs in his body or outrightly kill him. What are some of the steps to take in case of a drug overdose, a drug OD? Let's go through the steps to take in case of a drug OD, shall we? You can be a witness to a drug OD anywhere, anytime. Do you know that Americans are more likely to die from a drug overdose than from a car crash, making overdoses one of the most preventable causes of death in the United States of America and in many other places around the world? Imagine you're Haribo's cousin and you just stumbled on him at a dark hidden corner of this corner shop down the street, having a seizure, also known as a convulsion. He was at a party last night because you saw him through your window with his friends as they were walking past on the way to the party yesterday evening. You think to yourself, this young man of 25 has probably overdosed on cocaine, crystal meth, heroin, prescription drugs, or some other drug, or maybe even just alcohol. This is because you've seen him a couple of times while passing by this same dark area of this same corner shop together with some dubious-looking young men drinking alcohol. Since Haribo is having an ongoing seizure, you make sure the surrounding is safe and nothing is present that can hurt Haribo or you. You know that you shouldn't restrain him. He suddenly stops convulsing. Times without number, you've spoken to him about the dangers that many young people are exposed to by taking recreational drugs at parties or gatherings. Many times you have cautioned Haribo that young people who think they're having a good time don't even know the nature of the substances contained in the alcoholic drinks they consume, all in the hopes of enjoying that all-time high. So, you know that the first thing to do is to stay calm and assess his level of consciousness, because you know that if he responds to your call, he might be conscious and alert. In that case, you may just need to turn him onto his side because he would probably be breathing independently. By positioning Haribo on his side in the recovery position, if he is conscious, you'd want to take precautions just in case he vomits. This should help prevent any choking accidents, should it have occurred. You would have also reassured Haribo quietly because he may have been agitated in that sort of scenario. Unfortunately, however, Haribo doesn't respond to your call as you're shaking him and trying to wake him up by calling out his name loudly. You're also rubbing Haribo's breastbone with your knuckles at the center of his chest or rib cage and lightly pinching him on his chest. Haribo is still not responding and his breathing is slow. So you check Haribo's heart rate. Haribo's heart rate is slow as well. It's more serious than you thought. So you call 911 immediately on your mobile phone. In other countries, they may have a separate number, a different number for their emergency services. When you call emergency services, you try and give a clear address and a description of your location. You then remember the Good Samaritan law. Many states in the United States of America have passed the Good Samaritan laws that legally protect the person who suffered the overdose as well as those who call 911 to report the emergency. You, like many other people, believe that Good Samaritan immunity laws have the potential to save lives, reducing fear around calling for professional medical help. Drug overdose is a serious issue and can result in seizures, heart attack, stroke, coma, and death if not treated early and properly. You remember what a social worker had once told you. The person who had a drug overdose could suffer from in the long term. Long-term complications can occur if they do not receive adequate and immediate medical treatment. So you do not delay and immediately decide to start first aid intervention. You also notice that Haribo is burning up. Some drugs create serious overheating of the body, and so you immediately remove Haribo's shirt to allow air to reach his skin surface to assist with cooling his body. Then you recap in your head that rescue breathing involves several steps. And so you ensure Haribo's airway is clear by checking that nothing is inside his mouth or throat that is blocking or obstructing his airway. You notice a cigarette stub at the back of his throat. This can cause airway obstruction, so you immediately remove it. Then you ensure that Haribo's airway remains open by tilting the head back and lifting his chin. After placing one hand on Haribo's chin and tilting his head back, you then pinch his nose closed, like this. You then proceed to place your mouth over his to make a seal and proceed to give 2 slow breaths. Haribo's chest rises, but you notice not his stomach. Yes, you think, I'm doing rescue breathing well. You then follow up with 1 breath every 5 seconds. Rescue breaths are vital for survival in a drug OD because it keeps the brain alive. An opioid overdose can slow down breathing, limiting the amount of oxygen brought to the brain. After giving the rescue breaths, you evaluate Haribo again because you know that in some cases, giving rescue breaths is enough for the person to become conscious sometimes. But Haribo is still unconscious. Luckily, you've watched this video up here on how to perform CPR, cardiopulmonary resuscitation. So, you immediately start to give chest compressions by putting your left hand's heel on the sternum in the middle of Haribo's chest. Then, you put your right hand over the first one. You push hard, you push fast to give 30 chest compressions. By now, a large crowd is gathering around you both, and you can hear faintly in the distance the siren of an ambulance approaching. And then suddenly, Haribo coughs and mumbles something. He's breathing on his own again. So you put Haribo in recovery position on his side again, since he has regained some level of consciousness. Yes, you've done your good deed for the day. And you decide right there and then, in your heart of hearts, that this young man, your young cousin called Haribo, will never go back to taking drugs again. You intend to make sure of that. And to think that some of his friends who had gathered while you were resuscitating Haribo had fervently been urging you to try street methods of overdose resuscitation. One of them had suggested packing Haribo in ice, and the other two had suggested injecting Haribo with milk or saliva. Those methods, do not work, so you didn't even listen to them. Watch this playlist for more tips on how to save a life, and hit that subscribe button. Till next time, I love you. I'm Dr. Hadiza Maralia Suleiman.